Thank you, Chair. Just a couple of comments and then one question. Mr. Smith, you have a few times cited the Netherlands as possibly something that we should try to follow. Fact of the matter is, in the Netherlands, a 64-year-old individual that was lonely was given assisted suicide. 50-something-year-old woman who had a phobia of germs was allowed assisted suicide. If we followed the Netherlands completely, we would have about 9,000 cases a year in Canada. You say mental illness is exactly the same as any other illness. I believe that mental illness in people clearly impacts their decision to make sound, impacts their possibility of making sound decisions. I'm not sure how we can possibly square that mental illness, people with a mental illness can make absolutely sound decisions. I want to use one example, personal example, if I could. We hear over and over here again of personal examples. I want to use that, and then I would like Mr. Baillie at least to comment on this personal example. A very close person to me suffered an accident many years ago driving a four-wheeler, and he was driving it across the field, had an accident, suffered a head injury, spent weeks in a coma, came out of the coma, but suffered excruciating headaches, depression. Told me on numerous occasions how he had wanted to go out behind one of his sheds on his farm and kill himself. I believe had he had the opportunity to ask for assisted suicide, he may well have done that. However, he came out of this. His headaches disappeared, his depression disappeared, he ran his farm for a number of years before he tragically died of a heart attack. But nevertheless, here is somebody who probably would have, under what you're suggesting, have asked for assisted suicide. My question to you, Mr. Baillie, in your work, do you see that quite often, that people come out of this and, in fact, then lead very constructive lives and certainly have changed their mind about suicide? And Mr. Smith, I'm happy to have you answer it as well, but I would like to hear Mr. Baillie's answer.
We certainly are familiar with the phrase that suicide is typically a long-term solution to a short-term problem. And for some individuals, their mental health challenge can be short-term. It may relate to access to the appropriate kinds of treatment. It may relate to the appropriate kinds of support in the community. We need to make sure that the person has had the opportunity to access those kinds of treatments so that we're not making a decision for an individual that is life-terminating when there may be other much more positive options available to them. So the sort of story that you're describing is not uncommon in our field. The people come to us typically seeking treatment when they've reached a level of distress that they're looking for a professional to help them with, because they believe in many cases that they can get better. If they don't see immediate results, that may fuel a desire to end their own life. And if the regime was in place, then they may choose to seek out medical assistance in dying. We would rather, as the Mental Health Commission, focus on the potential for recovery and the options for people to succeed in the community.